You are, but welcome to our third National Coffee Chat. The SACME Regional Coffee Chats have proven to be an invaluable forum for sharing best practices among colleagues in specific areas. So the regional reps thought that having a national coffee chat would be a great way to continue building on the success of the regional coffee chats so that we can collaborate with our colleagues from all regions. So we welcome you here today to continue building on that success. I am your facilitator. I'm Adrienne Ross, and I'm also the Southern Regional Representative. Our panelists for today are Julie White and Kurt Snyder, and you'll hear from them a little later, and they'll tell you a little more about themselves a little later on. But I want to give the other regional reps an opportunity just to jump on and say hi and introduce themselves. Our Canadian regional representative, Susan Shane Weiss, is not here today, but she is our representative from our Canadian regional rep. And I've also posted the link to the SACME regional rep page so that you can browse that if needed to find out who your regional rep is if you don't know already, and the times of the other coffee chats in the regions. So I'll pass it over to Julie.
Thank you so much. So my name is Julie White. I'm the Director of Continuing Education at the Boston University Chobanian and Avedisian School of Medicine. It's taken me a while to be able to say that smoothly. And I'm the Northeast Regional Rep. And let's see, I'll turn it over to Laura.
Hi, I'm Laura Worrell. I'm the Director of Continuing Professional Development at Southern Illinois University School of Medicine, and I am the Midwest or Central, depending on how you refer to it, Regional Rep. And I'll turn it over to Jessica.
Hi, I'm Jessica Walter in Portland, Oregon. I'm at OHSU, and I am the Western Regional Rep. And thank you all for being here today.
Awesome. And again, I'm Adrienne Ross. I am in Columbia, South Carolina at the University of South Carolina School of Medicine and Prisma Health Hospital System, and I am the Southern Regional Representative. Laura and Jessica will be assisting with facilitation today and also monitoring the chat box to help us get your questions answered and to move things along. And also the link to the regional rep page, again, is in the chat box. Feel free to contact the reps with any questions about their meeting schedule or any questions you may have. I think we're going to get things started first with a few polling questions. Is that correct, Catherine? Awesome. So 3 polling questions just to help us kind of guide where we're going to go today. The first, do you have an overall structured process for conducting your overall program evaluation, or OPE? Which of the following do you utilize? And that's multiple choice: dashboard, data collected from your LMS or other. And do you have a staff person assigned to work this? If you could take a few moments to go ahead and answer those questions. Do you see them? Everyone see them?
Yes.
Okay, awesome. Okay.
Can't get my camera on.
I'll just give it one more second. We have almost 90% completed.
Awesome. Thank you, Catherine. And Catherine is assisting us. Natalie is unavailable or in a class today. So we do have Catherine here that's assisting us with our logistics.
All right, I'll go ahead and end it.
Awesome. Okay. So responses here, about 73%. Do you have an overall structured process? For question number 1, about 73% answered yes, and 27 with no. Which of the following do you utilize? A dashboard, about 19%. Data collected from LMS is 72%. And an other mechanism, with 43%. And do you have a staff person assigned to this work? 59% yes, and 41% no. Again, feel free to chat amongst yourselves in the chat box, but we're going to have Julie and Kirk now kind of tell us a little about them, their program, where they are, and their process for OPE. Julie and Kirk?
Thanks, Adrienne. I'll start. So our process, at Boston University's our office, we have about 15 staff. In 2016, we sort of changed our process. To be very candid, before that, we were, every time we went up for reaccreditation, we were doing an overall program evaluation and kind of scrambling to get it done and feeling like we needed to put a better process in place. So around 2016, we formed what we call the Overall Program Evaluation Committee, or OPE. And that group is represented by the people in our office who manage compliance, RSSs, quality improvement, strategy, outcome assessment, and then I'm always in that committee. Thank you, Jennifer, right? If truth be told, we're scrambling a lot. So we wanted to come up with a better process for, frankly, making it more meaningful than just kind of summarizing a sample of our data, which is what we were doing before. And so we started to meet monthly, and we continue to this day to do that. I will say, just looking at overall program data from our activities, we finally got a process in place, which I'll share how we do that. In the past, we've just been doing samples. So now we created in Qualtrics a repository so that all of our evaluation data that we want to look at, and that's not every single piece of data, we look at whether or not our content is rated, and this is a reflection of our evaluation, which Catherine will put in the chat. We're looking at how is the commercial bias rating, how is best evidence rating, and then whether or not people said that they were going to make a commitment to change, and whether or not there was follow-up data. So we just wanted to look at those particular data points. And so everyone in our office, every program manager, with the help of a student worker, puts data from their evaluations into what we call this sort of outcomes data aggregator. So that's one thing that we do. But also what the OPE does, the OPE committee, is we take a look at other things in our department that we want to improve and change. So, for example, we set a goal for ourselves to get joint accreditation with commendation, and set up a training schedule for about 1.5 years out, how we were going to accomplish that, what we were going to do to get ourselves up to speed. And then we have a monthly, what we call PDC, professional development and compliance meeting with the team. And so we use that. OPE sets the agenda. And then Elizabeth, who's our compliance person, who's on this call today, Elizabeth Drury, does the training with help from others on those monthly meetings. The other thing we've been looking at very recently, Linda, who's our strategy person, did an audit of some of our files, and we found some areas that we need to improve. So we're going to be doing training on that. And other things that will come up might be sort of ongoing training needs of the group. So that's sort of the goal of our overall program evaluation committee. We also set the agenda for our summer annual retreat, during which time we sort of look back and reflect on how we're doing, and also do some training overall for the team. Kurt, I'll turn it over to you.
That was impressive. You have a committee. We don't have a committee.
Oh.
I think I want one. Hi, everyone. I'm Kurt Snyder. I'm on the West Coast now. Formerly, gosh, it's been about 5 years ago. I was at Indiana University. Now I'm at Stanford. I have a team of about 25 full-time employees, and we have about 15 contingents here and there doing work for us. We are a large program. I would say that we have a pretty mature evaluation process. Interesting enough, we plan on kind of doing a little bit of an overhaul this year. If I was writing my self-study right now, I would say that we take a multifaceted, multi-pronged approach to doing our overall program evaluation. We do evaluate each of our activities individually, and then we have a process where we kind of create this dashboard, and we kind of roll up those individual activities up into kind of a holistic way that we can look at things. We also do an annual evaluation that we do every year. And then we also do what I would call a 6-year cycle accreditation. On a regular basis, my physician leader, Daryl Oakes, and I will be meeting with department chairs, and we do both focus groups and one-on-one meetings with our chairs. And so we kind of put all this in a big bucket and kind of look at things from different angles. So again, we have our individual activities that we're looking at them from a data perspective. And then we have these individual evaluations that go out from a program perspective every year. And then we're meeting with our department chairs and doing some focus groups just to kind of get feedback. So I would say we're constantly trying to get feedback on how we are doing. We embrace lean and strategic planning. And so when I started, we created a 5-year strategic plan. We're just about ready to announce our next, so it's going to be a 6-year strategic plan. So really for the last year, we've been hitting hard strategic planning. And that took a lot of effort. The entire team was involved. We did over 25 different environmental scans. And part of that process was to kind of get input from our learners. Like I said, we actually, interestingly enough, we want to kind of overhaul our program evaluation, how we do it. Right now, it kind of serves multiple purposes. It's kind of compliance, needs assessment, and we have learners from so many different places now. I think we got to start just separating things out. For example, something that a Stanford faculty person might say might be weighted differently or just viewed differently than a learner from outside the US that will never come to Stanford. And so, but we kind of right now are kind of evaluating this all at one time. And I think that, I don't want to say it skews our data, but I think we need to kind of make sure we figure out who's saying what, because I think it might change how we do things. And so we're going to try to do a better job of that. Also, we actually think that there's a lot of value in the data itself, and we have I think we can actually use some of this data and the power of our database to actually create some scholarship and to make some decisions based on that. So you kind of want to move down that road as well. And so uh, super excited about using evaluation in the future. I'm fortunate where I do primarily use, we have a staff person, some of you may know Jason Alberto, who, by the way, kudos to her. She just had her first child. She's on maternity leave, so she would probably normally do this, but she's literally out. She should be back soon. But she leads up most of this, but I would say many people on our team are involved in evaluations.
Awesome. Thank you, guys. Laura, Jessica, do we have any questions in the chat box that we can present to Julie and Kurt?
There is interest in knowing more about your dashboard, Kurt.
So about 2 years ago, so I will say, again, I'm old. I've been in SACME for a long time. One of the things that's been hard for me just over the years has been some type of tool that helps us track tasks. I've tried so many different things. And so I have, every place I've worked at, I've had a pretty large team. So I might have people working on 2 different projects, tracking it in a totally different way. I'm so much into lean, I try to kind of standardize processes. Make a long story short, 2 years ago, we switched to Asana. Now, again, it's a task management tool, but the reality is in Asana, you can track a lot of data too. And so for each of our activities, we track certain data pieces, and we can basically put all that data on our activities, and so we can see it all in one place. And so we track financial information, we track evaluation information, we track lots of tasks about things, but we have found it to be really, really helpful. The team, on the most part, has embraced it. We have thousands of tasks going all the time, and it's been fantastic for the team. And again, it's not, if you're familiar with Asana, again, the reality is it's a task management tool, but since you can track things at the activity level, you can also use it like a dashboard.
And then Kurt, somebody else asked said that you mentioned focused meetings with department chairs, and if you could elaborate a little bit on that.
Yeah, so the reality is I work at a medical school, and our faculty are super important, and we got to make sure that they're happy. And so uh, sometimes these are formal meetings, sometimes they're informal meetings, but we have a regular kind of, I would kind of say, a rotation where we just try to make sure we're reaching out and touching base with our faculty. for better or worse, sometimes we are way more engaged in certain departments than others. And one of the things that we're really trying to do in this next strategic planning cycle is to take a deeper dive and work with faculty and departments to make sure that they're doing more of CME. The reality is my historical traditional model that I've seen at medical schools is basically CME offices wait until someone calls them up on the phone, sends them an email and says they want to do an event. We're trying to be much more strategic and meeting with faculty and the department chairs and basically saying, hey, here's what you're currently doing. Here's opportunities for you, to try to really motivate them to do more. We don't have this yet, but it's on our goal pipeline, is to kind of create like a dashboard that we can compare departments to kind of help motivate them to see where they're doing. We're really excited. The Department of Medicine has a new person that is excited about CME. We're kind of trying to use them as a model. Like many schools, our Department of Medicine is by far the biggest department at our institution. And we really think we could do a lot more. The amazing thing is we do a lot, but the reality is when you get down to the very specific topics of what you could do CME on, there's so many things that we don't even touch just because people aren't motivated to do it. And we're trying to be more strategic about that. By having an opportunity to talk to our faculty, it helps tell our story. I will say that one little trick to this is getting on agendas that already exist. So sometimes, they're not always the most excited about, hey, I want to spend a lot of time with the CME department. So they might already have a departmental meeting. They might have an executive type meeting. And so we get on those agendas to in essence, tell our story, which we're constantly trying to do. And by the way, there are times where, we hear things. By the way, I actually forgot one important thing we implemented, gosh, about 4 or 5 years ago. On an ad hoc basis, usually for our bigger events, we have our physician leader reach out and have a one-on-one phone call with the course director, just to kind of get feedback on how our office did. And it's a great way to, the course directors, I think, feel heard. And there's all kinds of things that you hear from those conversations. Sometimes it's not easy to get constructive criticism. Sometimes, I might even be dismissive of some of the stuff they say because they don't quite understand the context. But ultimately, it's helpful to hear that information and to try to do what we can to provide a better service.
Awesome, Kurt. Julie, can you tell us a little more about your Qualtrics survey and also the data pieces you collect from that? And how do you share the data? Do you have like data visualization tools that you use, or what's your process around that?
Yes, sure, Adrian. So thanks everybody for the questions. So essentially the data that goes into Qualtrics is summary data from every single activity evaluation summary. So if we have a conference, we get the data through our evaluation, and then portions of that go into the Qualtrics survey, which is like a data aggregator. So the fields include, did you detect any commercial bias? Was this activity based on best evidence? And we're happy to share this as well. Because we're joint accredited, we're asking a couple of evaluation questions around the interprofessional team. Do you think it contributed to improvements in the team? Are you planning to make a change in practice? And then for those activities where we were able to receive follow-up data, that goes in there too. So again, that's a subset of the questions that are in our each evaluation. And what we made kind of a strategic decision to include these questions because that's what we write about in our self-study, or what we wrote about last time. What was the other question, Adrian, today? Oh, what do we do with the data? Right. So Qualtrics allows you to do data visualization. And what we typically do is present that during our annual retreat. And we also put it into our annual report, some of it.
So awesome. Transition to, okay, a question that came in, I think more broadly, but we'll have Julie and Kurt answer it, and then do maybe a little crowdsourcing too here around the use of an assessment professional. So do you use a statistician, a psychometrician in helping with your data analysis? I'm going to add to this and say, How has anybody gotten creative about this or making the case for this? But Julie and Kurt, will turn over to you, and please, everyone else, contribute in the chat.
Do you want to go first, Kurt?
Yes, I think the general answer is no. So, especially on what I would call our program assessment type stuff, this is going to come across as bad, but the reality is that uh, almost no one is asking for this data. This is information that we use. We use it for compliance purposes. Again, our office uses it. Jay Zona is very talented. She does have a PhD in education. I'm not quite saying she's a statistician, but she's a very talented person. We feel comfortable with what she's doing. We will, once in a blue moon, use a statistician for evaluation purposes on big grants. So I want to make that clear. I want to put that in a separate bucket. But for the purpose of just looking at our program assessment data, the other takeaway I'll say to everyone is when you collect the data, make sure you're doing something with it, because if you're not, then don't collect it. And so that's one of my mantras. The reality is we have a lot of activities, and I'm looking mostly for outliers. I'm looking for events that for whatever reason are doing poorly. I'm looking for events that are, for whatever reason, are doing great. We have a lot of events that are doing good, which is great, of course. But I don't do a whole lot with that other than feel good that, hey, we have a lot of events that are doing well. And so we don't actually take action on all this data other than really looking at the outliers and making sure that we feel comfortable that what we are doing is moving down the right path. So I'm not even sure, and maybe I'm being naive about this, of like what I would do with a statistician and what that information would do for me from a decision-making standpoint. I'm basically trying to make decisions based on this data. And so the answer is no. Again, on some specific events where we're digging deeper, especially if we're trying to get into level 6 or 7, we might hire a statistician, but just for program assessment stuff, we do not.
So Kurt, a follow-up to that, you mentioned that is for your use in decision making within your office, but then you also mentioned that you share the data with some others. Who else on your campus are you sharing that with?
Just leadership people. Again, that sounds horrible, but it's almost more of a FYI, here we are type thing. I'm not sure if they do anything with it. I'm very proud of my program. I think our dean is very proud of our program. Our school is very proud of our program. But I don't get the sense that anyone's looking really deeply into CME and what we're doing and looking at the data closely. I think they have trust in what we do. One of the reasons I mentioned about talking to the department chairs and focus groups, at the end of the day, what's important to my school from just a holistic perspective is that department chairs and our faculty are happy with our office. And so making sure we understand that, who we are and what we represent and serving them is important. Now, from an educational perspective, from a CME perspective, this data is way more helpful to me, but I need to make sure my faculty and department chairs are happy with our office.
Same questions to you, Julie.
Yeah, so funny you should ask about the statistician, because and actually I'm just looking at what you put in the chat, Deborah. We actually have from time to time worked with our, it's called BDAC. It's like biostatistics, epidemiology. It's similar, I think, to what you're mentioning, Deborah. So we haven't really worked with them consistently, but we're going to start doing that now. They are well established. They've been at our School of Public Health for like over 30 years, have a team of 27 people. And we're thinking, why aren't we working with them? Because some of the outcomes reports, for example, that the funders require are getting more and more demanding about, with statistical significance and, things, effect size and all that. So we're definitely going to start using them. And then let's see, what was the other question, Adrian?
Who do you share the information with in your organization?
Oh, yeah, so interesting. So more, it's just if we're asked, we share it. what is curious is I see the questions about annual report. So when I started in my department in 95, we used to have to submit an annual report that went up to the dean. And gradually over time, they stopped asking for it, just like Kurt. And I think it was like, okay, well, should we keep doing it? But I realized that it's actually a wonderful snapshot of what we've accomplished in the year. So over time, I've added to it. So I have like sort of highlights about what our quality improvement group is doing, we do some international non-accredited things. What happens, what's going on there? How do we do on grants this year? How many activities did we produce and how many of them were interprofessional? So, but actually what's interesting is that one of our team members brought up recently that we should make it look really snazzy graphically. And I thought, oh yeah, that's a great idea. So now I'm thinking, and actually as a result of us talking as a group, getting ready for this meeting, we were talking about this a little bit, and I thought, wow, I think we could use that for an external audience. And the great thing about media these days, you can cut and paste what you need out of the group. So the grant stuff, I might not share that with the outside world, but there's a lot of good stuff that we're doing. So I think we're going to try to do a better job of distributing that, actually. So great question.
And that's one of the questions that I'm sorry.
I wanted to add Jayzona created a beautiful 20-page assessment document, which again, I think the reality is we use it mostly internally. When I say internally, meaning our office, I think it is important for the people on your team to know the value of what the work that you do. And so we use it mostly for that. I say this mostly jokingly, but there's two people above me that are really important. And one's classically, when I engage with this person, basically I'm told, do it like in one paragraph or two paragraphs. I have so limited ability to share information. And so again, it sounds horrible, but I'm not convinced true leadership at the school is ever going to look over a beautiful 20-page document or whatever. So it's just a fact.
Since the question came from the audience, I'm curious, is anyone in the audience willing to share if they have a statistician or a staff person devoted to this in their office? And or any unique ways that they're sharing the data that's collected from these evals? I do think it is, we at one point did use a summary of some of our eval information to kind of show or to help show our value and to brag on our office a little, because we kind of sit off in a silo and we want everyone to know what we're doing and all the great work that we're doing. So ours was kind of like a visual as well, Julie, that we shared a few times, but we didn't get a lot of feedback on it. So stop. So we're kind of trying to look at a different way now to possibly present that to the organization as a whole, and on what frequency we want to share that information.
Adrian, based on some of the comments in the chat, you are not alone in that question about how do we want to present this information and share it. So if folks have ideas about reports or presentations they're proud of, maybe we can collect these and share them with the wider group.
And there are a few, and I'm just kind of scanning the chat, but request Julie and Kurt for you to share. I think Julie's eval has already been shared, but Kurt and Julie, your reports or your summary reports, if you don't mind, if we don't have them available now, we will, when we share the recording link, we'll possibly attach those at that time for those that are interested as well.
Hey, I wanted to respond to Bonnie's thing. One thing that does resonate with my leadership, meaning the dean, is comparing ourselves to peer institutions in other medical schools. And so we do track every year. Yeah, as you may or may not know, the SACME basically publishes basic stuff about every provider. And we do use that. And we have some beautiful charts and beautiful things. It shows how we've grown, how we compare. Basically, anytime we want to do something new, we'll get, hey, what is UCSF doing? What is Harvard doing? What is Penn doing? And that resonates with them a lot. And so we have some beautiful charts that we always use for that. It's I wouldn't say it's buried, but I think a lot of people aren't aware. When you go to the CME Find a CME provider page on the ACCME website. If you go down a little bit, there's one little link. All that data is in Excel. And so you can pull the provider data of every program in the nation. And it's usually updated around March and September of every year. And so I make sure I pull it every year in September. And so I have a multi-year history of how we are doing, how we are growing, how do we compare. And that really helps. And it really shows, because sometimes when in their mind, how they think we are doing isn't really necessarily connect with the data in that list. And so that's one thing that we find very effective. And Bonnie, to answer your specific question, I love that one pager. Used to be really easy to print out from PARS. I want to say that I thought they added it back in, but we definitely make sure we capture that data either way. But anyway, we love the summary PARS data report that comes out every year.
Kurt, I see another question for you from Jennifer, asking if there's a place in Asana to track evaluation data, or are you mainly using it for workflow and revenue type tracking?
We definitely have the pro account, but I thought you could do this in any of the accounts. You can pretty much add an unlimited number of fields in Asana. So we just keep adding fields, and we add fields, and we can track whatever data we want. And we have some Asana boards with 100 different fields in them, and we have some big Asana boards.
Yeah, Kurt, I might reach out to you one-on-one and pick your brain about Asana, because we're using the free version, and I'm trying to make the case for an upgrade. So if you don't mind.
It's been a game changer. The one feature that I loved that I could never find was the ability to task others, especially if they're not on the project. So again, we use it for everything. So if we're on a team meeting and Kurt agrees to do this, boom, it's a task in Asana. If Bob says that he's going to do this, it's in Asana. So that has been a game changer. I saw some people put Smartsheet, and quite frankly, I think Smartsheet is better just for the purpose of pure tracking data. And so if I was just creating a dashboard, I would use Smartsheet. I'm a longtime Excel user. Smartsheet is very comfortable with me. I kind of pick and choose my battles. And so the adoption rate in my office of Asana has been so good that people have just found it easier just to tag it on to Asana. Because if you have a list of all your activities, one of the challenges of when you start using tools outside of your core, your let's call it LMS. Let's say we use cloud, whether you use cloud or Ethos. If you start using these shadow systems, that means you don't have the other listing of all your activities. It gets hard. And so keeping that to a minimum is helpful. And again, if I was just creating a dashboard, I would use Smartsheet. But because we're used for the task and we already have all of our activities in Asana, we just added onto that. And again, every person on our team uses Asana, and it's I don't know how many tasks we do in there, but I'm sure it's thousands and thousands every year.
I think Sue Ann has a question.
Yeah, hi everybody. I'm from Northwell Health, and we support at least 15 hospitals and a medical school, and we are a team of 11. And when Kurt was talking about Asana, which I never heard of, it seems very similar to Smartsheets. And we have used Smartsheets to track anything from, okay, which service lines are doing the most programs, which service lines do we have to reach out to say, hey, why aren't you doing any education for your staff? We could track what kinds of monies we're bringing in yearly, like if we fully manage a program or partially manage a program and we get our CME fees. We have all these different fields that we can, formulate and use. We have like about 10 different reports that we have formulated. Like for instance, in Smartsheets, if somebody wants to see what are the upcoming conferences, just to say, in 1 second, you're in there and you see the whole picture in case somebody is calling you to say, hey, I want to do a conference in September. And we say, we're filled up for the beginning of the fall, but you could try the end of the fall, beginning of the winter. We have certain ways of which people will apply. And we have an online application process that we started about 3 years ago, but we're very happy that the health system, our large health system, is very happy with the way the team is functioning as a well-oiled team. Everybody is doing their own projects. We have project managers that assist the administrators with the projects, and everybody has their part to play. But we have gotten a 6-year accreditation over, like, this is going to be I'm there 18 years. This is going to be my third accreditation, but now it's going to be for joint accreditation because we became, we're in 2025, we're coming up for our second JA reaccreditation, and we're very excited about that. And also to tell you, with the joint JA experience, we have all the other clinicians in the system are very excited that they can get their own individual credits, which we are excited for too. And it does promote a lot of interprofessional team building and interaction. And the other thing is, we feel that there is a lot of value in CME. And every time we do have a discourse with the department, we try to engage them in putting some kind of interactive learning in your program, not just to have lectures, and just Q&A, but to do other types of things, whether it's before and after questions, whether it's polling, and as far as the evaluation goes, we do an evaluation after each post-conference, and it's either in Microsoft Forms, in SurveyMonkey, or in REDCap. We find that the emergency department uses REDCap a lot, but our department uses SurveyMonkey when we're fully managing a conference. And most of the other departments, when they're managing it themselves, they use MS Forms, and we've created a whole link with the template, and all they do is click onto the link and they just add the information that's related to their content of their program. And then when the program's finished, they just send it off. And we have shared all this data with the course directors. And a lot of the course directors have shared it with their chairman. And they always want to do something more to improve. And we're trying to improve as well.
Awesome.
Great. Well, I thank you for that, Suzanne. One thing I'm noticing in the chat is perhaps a show and tell of different Asana and Smartsheet or various other setups that may be appreciated.
That may be a topic or a session for our next National Coffee Chat.
More so than the need for a statistician. How do we organize all this information? Yeah. There is a comment, well, we're still talking about data I want to come back to, which is, you've spoken a lot about the more quantitative components of or binary yes, no, free of bias. What type of qualitative data are you collecting? How are you analyzing it? How are you using it?
Jessica, are you asking us that, or the whole everybody?
Yeah, I'm asking. Let's start with Julie. Let's start Julie and Kurt, and then we can see who else wants to add to that.
Yeah. So the question is qualitative data, right? Yeah. So I just actually pulled up our annual report to see what I could share here now. And again, it's not fancy, but what we do is kind of, because I feel like this is important for the future, like, in there's sort of the story of what's going on in each programmatic area that we work in. And also, like, for example, in the last 3 or 4 years, we made notes about what was going on with conferences because of COVID, right? Because, it's like, was recent history, but we'll forget in a few years. So we have a few comments about that. There's also kind of like, what are our projects or goals for next year, that kind of thing. But I think it's more what we're reporting or recording or capturing is really reflection amongst ourselves, what's happening. Just sort of listening to other people and thinking there's probably more we could be doing that's going external to get information and then bringing it back in. Or even more about kudos from our learners, that kind of thing. So that's what we do.
I would say this is one of the challenges of doing evaluations, those kind of things, is how do you, if you get hundreds of responses, how do you deal with that? I will say AI is proven to be helpful to us when it comes to reviewing unstructured data. So that's been helpful. I'm looking at my program assessment from the last year, and there are just a few areas where we kind of give free-form text ability. One of them is we have a barrier question. I'm personally big on the notion of trying to figure out why our clinicians did not make a change based on whatever we were trying to provide the education on, because I really think that's often the crux of the issue, is not, I hate to say, not the learning, it's the actual, did they actually make a change? And if they didn't, why didn't they make the change? And figuring out that is a challenge for us. I would also say this is where the focus groups come in, the boards, the conversations come in. I'm bullish on AI and the potential of using it. I honestly believe over the next 10 years, the way we do evaluations will be totally different. And just an example I'm trying to say is we often do these surveys because it's the only efficient, practical way of doing it. I have to ask the same questions of every single person. We might have a little bit of piping, where you ask this one question based on what they say, you ask something else. But with AI, we have the potential of literally having a conversation. So instead of, and again, we don't have the time or resources to do a one-on-one interview with 1,000 people. We just don't. But if we were using AI, it's possible you could, in theory, have a conversation with an individual that goes way deeper, gets deeper and deeper based on that conversation. We're not there yet. I'm not suggesting that we are. So don't, hey, don't email me saying, hey, how you doing this? I'm just trying to say, I think that's the potential. I think that, I think the value, and I think we're going to get in response is going to be a lot better. Right now, it's pretty basic. We know, a certain number of people agree, certain people disagree, certain number of people are strongly agree. That's the kind of things that's easy to get in an evaluation. When you get a lot of free-form text, it's hard to interpret that. You get, even on those, sometimes you get people that will put in one-word answers, other people put in paragraphs, and if you have 1,000 responses and you have 4 people give a paragraph, how much do you even weight that? So it's hard to even know. It's hard to even know what to do with that. But again, going back to the importance of our chairs and our faculty, the reality is the chair of our Department of Medicine is important. What they say, whether it's good or bad, is important to me. And having that feedback drives a lot of what we do.
Awesome. Lots of resources and information in the chat as well that we're sharing, the audience and everyone is sharing too. I think we have one last set of polling questions, Catherine.
Yes, we do.
Okay. If we could just pop those up really quickly. Question number 1, do you conduct your overall program evaluation annually or leading up to reaccreditation? And the responses are anonymous for those of us that kind of scramble at the last minute to get this done. And number 2, do you use your OPE data to leverage a beneficial change for your group, including gaining resources?
I'll give it about 10 more seconds. We have about
Okay.
60% participated so far.
Awesome. And while we're finishing that up, Sue Ann, you had your hand raised again?
Yes. When Kurt was talking about the barriers question, and you want to know why they didn't have time to make the changes that they intended to make, we have a pre-populated question that we polled a lot of our clinicians and physicians in all different departments, and came up with basically a list of 1, 2, 3, 4, 5, 7 things, and if those weren't met, then they could put something in on other, like lack of evidence-based guidelines, lack of applicability to guidelines in my current practice, patients, lack of time, organizational, financial, insurance reimbursements, patient adherence, compliance, treatment-related adverse events, and then they have room for other. So, a lot of them, it's all a lack of time. Sometimes it's due to they can't get, certain products that they're using on patients, like if it's a wound care and it's a financial matter. Sometimes it's just lack of adherence on patients, that they're just not compliant. But we also send out an annual survey to all of our participants from all of our conferences. We do that to see, what is meaningful to them.
Great. Awesome. So the poll responses: do you conduct your overall program evaluation annually or in a rush leading up to reaccreditation? 57% annually and 43% leading up to reaccreditation. And then using your the data to leverage a beneficial change for your group, including gaining resources. It's almost 50-50. So 48% yes and 52% no. Anyone that answered yes, are you willing to share with how you use this to leverage change for your group?
Hey, that's a different question. I said no in the sense of we don't use it to get more resources. I'm in a situation where it's extremely unlikely I will ever get more money out of the institution for my program. I view it as a win as long as they don't take money away from me. I don't even like to ask for money because I view it as an opportunity for them to talk about my money and potentially take it away. So we don't use it as a way to basically ask for more money. But the tweak that I'm saying is different question is we do use that data to make strategic decisions all the time. We do use that data to do things. I just don't use that data to go to the institution and ask for more money.
I could chime in about using data for change, as Julie pointed out. We use our annual report and all the information gleaned over a year from our overall program evaluation committee. And at our annual retreat, we use that data to inform what we will be talking about, and then our focus for the year. Not that we don't ask the rest of the team during that retreat, what would you like to learn more about or work on? But so in terms of change, we actually use a lot of that data to make change in our office, how to better incorporate team behavior into our content, or writing a learning objective geared towards the team. So we definitely use it every year for our advantage of improving our overall program.
Julie, do you have any comments for that?
No, Elizabeth said it beautifully, but yeah, I think it's also very handy just to have, I'll give an example. Joyce actually asked me to talk about quality improvement at the SACME meeting last year, and I thought, oh, I need an overview of our program. And I'm like, wait, we did that for the annual report. I could just go grab it. So it's like things that will pop up, right? That are just so, it's so helpful to have that all there. And then also, I think it helps us realize, oh my gosh, we get focused in our own little niche areas, but the rest of the team is it's good for us to just sort of know what's going on with each other. Like, oh my gosh, this is happening over here and this is happening over there and that kind of thing. So, yeah, so it's like you just never know when you could use that.
Awesome. We're coming close to time here. Jessica and Laura, do you have any other burning questions or themes or topics in the chat?
I just have something I want to highlight here that Jennifer Alessi put in the chat a little bit up. 9:42 is the timestamp. At the Alliance meeting, anyone who's going on February 7 at 2 p.m., they're going to be doing a workshop on using task management systems. So that seemed like a hot topic this morning.
Can I ask a question? When you say doing the evaluation annually, do you mean like just once a year?
Mm.
Like we do evaluations for every conference, every time it's held.
So,
And for our grand rounds, we don't do it once a year. We do it twice a year. And outcomes, no, they do, our grand rounds do it many times during the year, and they get the outcomes twice a year.
Yeah,
and I think this was targeting the actual overall program and not the activity evaluation. But Julie, you can chime in if I understood it when we created this. But I think it's the overall program, so your program's evaluation.
Okay,
right.
got it.
Yeah, exactly. Because that's in your in the self-study for both
Right.
JA and yeah. So it's like,
Yes,
how are you?
we
And
do.
it's always hard, right? And you know, are you meeting your mission? Which is
Yeah.
we always try to point the data back to that.
Okay, thank you.
Awesome. Final sweep of questions in the chat, Julie. Sorry, Jessica and Laura. And if not, Julie and Kurt, any parting words or any advice or any resources that you think that would help those of us that are like myself that are kind of trying to figure this out? You guys have seen you have a pretty good plan to do that. So any words of advice and encouragement?
Yeah, I guess from my point of view, our point of view, I just wanted it to be a meaningful process, not something that we scrambled to do, you know, for our self-study, which is really what it used to be. So it took us a while to come around, you know, to get to that. But for me personally, it's one of the most professionally fulfilling part of my job. I love our OPE meetings. Half the team is on this call. I'm not just saying you did that because they say that because that you're here, but I just love it because it's like, it's really like continuous quality improvement, right? Like taking a look how we're doing and, you know, where do we want to go? How are we going to get there? Yeah, so I find it a very fulfilling, it took us a while, but I find it now a very fulfilling part of how we run our shop.
I have a question. How do your departments or your offices partner with quality improvement
Well,
department overall?
That's a whole topic for another coffee chat. And Natalie,
No, I'm sure it is, but you know, we've tried over the years. Now we have a new AVP there who may be more sympathetic to our needs. You know, so our physician leader, Dr. Penny Stern, is going to set up a meeting with him. And since quality improvement is like an area I'm very interested in, I'm probably going to be at that meeting. So I'm excited for that because it hasn't happened in the 18 years that I'm here.
I know. Yeah,
I mean, we tried it in the past and we've had meetings with all the different directors of each hospital and quality improvement. And then nothing happened after that. You know, it was like at a dead stop.
Yeah, so we can completely talk about that in a whole. So in a minute, we're going to do a quick evaluation. And Suanne, definitely put that in as a topic of interest because we could spend an hour just talking about that very easily.
Okay.
So yes, we do a lot with them, but it took us a while to get there. But now it's like going like gangbusters. So
nice.
Yeah, so let me turn it over to Kurt.
My last thoughts, I want to double down what Julie said. Specifically, I would say to you, only ask questions if you're going to do something with that data. And so you want to think that through. The other thing that I wanted to say that I never got across was there's a balancing act between what you want and how much they're going to spend time in responding. And so I feel like this is, I'm always arm wrestling with Jay Zona and my physician leader, Daryl Oakes, because we can all think of great questions. It'd be great data to have, but are the people filling out these surveys, these evaluations, would only commit so much time to them. And so you have to be realistic about like how long these things can be. And so in a perfect world, the shorter the better. But I get that cuts against getting great data. This is where I would say the focus groups, there's other ways you can kind of do that, but you guard against coming up with a 100-question evaluation because no one's going to.
No.
So you want to keep it short and make sure if you're not going to do something with the data, then why are you collecting it at all?
Yeah, and Kurt Olson wrote a tremendous article about that. Mila, you're our kind of journal person. I don't know if you remember the name of it, but it had the word commons in it. And the whole point was It was sort of like I think the analogy was with antibiotics, right? Don't blast everybody with antibiotics because they lose their effectiveness. His whole idea was don't blast everybody with surveys and evaluations because you're not going to get very good results over time. So I wholeheartedly agree with that.
According to the evaluation, what Kurt said, well, we have pre-populated certain questions, so it's easier for them to do it. Like we have 2 interprofessional questions on the evaluation, and on the outcomes one, we have that pre-populated question about the barriers. And the other thing is that now I lost my train of thought. I'm sorry, but anyway, so we have shortened the evaluation in that way because if they just check off something, it's easier, quicker. Oh, this is what I wanted to say. We have gotten into a process with our staff, with our project managers that send out the surveys, that we send the survey out like almost near the end of the program. And we have someone make an announcement. Now you have the link to the survey in your smart devices. Please take a few minutes to complete it. And if they do it then, we find that we get many more responses than waiting till they go back to their offices and they're bogged down with their patients. And, because patient care is more important, of course. So that's, I think, process improvement that we made from the CME office. And the cost directors are in agreement with it. They like it.
Yeah. Awesome. We're coming up to the top of the hour, so I want to respect everyone's time. I do want to make mention that Joyce has been so kind to put in the chat information on SACME's Prime, which is in Toronto, June 18th through the 21st. There's also a link to the annual meeting, and early bird registration has been extended to February the 5th of 2024. So there's still time to get in on the early bird registration for the annual meeting. Also, thank you guys. Over 60 of you came out today to engage in this very, very hot topic that we all seem to be having to work out in our offices. So we thank you for that as well. In a moment, a brief survey will pop up. We ask that you do take a couple moments to answer the questions on the survey. That will help us in planning the future National Coffee Chats. Again, thank you for spending this hour with us, and take a minute, go through the chat, look at those resources, and we will see you next time. Thank you so much. Have a great day.
Thank you.